All right, good afternoon, everybody. Thank you so much for joining us with regard to our press briefing here today. We've got an important announcement we're going to be talking about with regard to staffing in hospitals in the state of Nebraska. And I'm going to start with some of the challenges we've seen in our hospitals. Certainly one of the things that has been documented is the increasing number of COVID cases on top of a workforce shortage that has existed prior to the pandemic as well. And then additional hospitalizations that are coming into our hospital system that could be related to delayed care last year, that sort of thing. And then just in general, the ability to keep up with other things that are going on, like was reported in the Omaha World Herald with some RSV cases coming into the hospital as well. So first of all, what I'd like to draw your attention to is this chart over here. So this actually compares back at our peak with regard to coronavirus cases, November of last year, with where we are today. So actually, this is yesterday's data. So if you look here, you'll see that we had available beds of 1,165, which represented 29% of all of our available beds. We were at 987 hospitalizations, which represent 32% of all of our hospitalizations. And then we had non-COVID patients of 2,087, which represents 68% of all hospitalizations. So again, the 32 plus the 68 gets you to 100%. Now, if you look at today, where we are, we're at 1,045 available beds. That's about 25% of our available beds. 337 of those are COVID patients. That's about 11% of our hospitalizations. And then when you get into other reasons for hospitalizations of 28, 25, that makes up 89% of our hospitalizations. So about a 35% increase you can see as far as people in for other reasons besides COVID versus where we were in November of 2020. So again, getting back to that significant increase in other reasons for people to coming into our hospital system. And we have seen hospitals take a number of steps, such as voluntarily ending elective surgeries. So in order to be able to help assist with what we're doing there, we're going to continue to follow what we've always done with regard to the pandemic, focus on hospitalizations. Now, here in Nebraska, we've done a very good job throughout the pandemic of making sure that we continue to provide that hospital bed, that ICU bed, that ventilator for anybody who needs it when they need it. And in fact, if you look at throughout the course, I think it was the Kaiser Family Foundation says that Nebraska ranks number 3 as far as best states for preventing fatalities because of COVID. I think we're tied with Vermont. And then number 14th ranked overall with regard to getting 65-year-olds fully vaccinated. So we've done a great job of getting people who are the most vulnerable vaccinated here in the state. But with where we are with regard to the statistics, and the challenges we have with regard to staffing, what I'm going to be doing is declaring a hospital staffing emergency in the state of Nebraska. And we're going to have 2 components that go along with that staffing emergency. One is an executive order that will bring back some of the things that we did when we had the COVID emergency. We're going to be waiving, for example, some of the licensing requirements that are out there for hospitals. So we're going to authorize the credentialing of retired or inactive nurses or healthcare professionals, deferring continuing education requirements for healthcare professionals, suspending the statutes around new healthcare providers seeking a license to practice, deferring some of the continuing education requirements, so for example, having to submit your test scores before getting that provisional license, and so forth. So, and then waiving the statutes on regulations that set specific supervision ratio requirements for that. In addition to that executive order that should make it easier for hospitals to get the staffing they need, I'm going to be issuing a directed health measure that will be effective starting Monday, August 30th, and that directed health measure will be to limit elective surgeries in the D and E class. So these are elective surgeries that can be delayed for 4 to 12 weeks or beyond 12 weeks. Similar to what we did again in that last fall when we also suspended those elective surgeries. So this will be something that will apply to all hospitals. Obviously, like I said, some of the hospitals are already taking steps to be able to do that, but we're going to make it mandatory here in Nebraska to be able to help free up hospital capacity to take on some of the other patients that are coming into the hospital, both non-COVID and COVID patients. These are elective surgeries that, again, can generally wait. As I said, that will be effective starting on Monday. And then just a couple of other issues to highlight. One is, obviously we've been talking a lot about masks. I am still against mask mandates, vaccine passports, specifically when it comes to kids in schools. We know that kids are the least at risk of anybody who gets COVID. If you look at Nebraska data, we can see that children are no more at risk for fatality from COVID than they are from the regular flu. And yet we don't mask kids up for the regular flu. So I'm against the idea that we mandate those masks in schools. I think that should be something that's voluntary, something that the school districts can work on with parents. So that is something that, again, I just don't think that if you look at who's at risk here, it doesn't warrant putting kids in masks because they are the least at risk. And then finally, want to reemphasize, our best tool against the virus is getting a vaccine. Vaccines work, folks. We've got lots of data from here in Nebraska how vaccines work. So they're very effective at making sure you don't get sick. They're very effective at keeping you out of the hospital and preventing those very severe reactions, including death. So please get vaccinated. Obviously, Pfizer this week got recognized or fully approved by the FDA. So for those of you who may have been waiting for that FDA approval, please go get your Pfizer shot. And if you've got concerns about that shot, go consult your healthcare professional. But that vaccine is the most important tool we have to combating the virus. We know the vaccines work here in the state of Nebraska. We had a long-term care facility that one of the staff tested positive, so we test everybody. And we found 23 long-term care residents tested positive. 21 had no symptoms. 2 had very mild symptoms. So again, very effective at keeping people healthy and keeping them out of the hospital. So please get the vaccine. With that, we'll go ahead and open up to questions and answers on the emergency order or the DHM. Yeah.
So with the DHM, the two things you mentioned, I believe some hospitals are already sort of delaying surgeries, and with regard to the relaxing requirements, that's something that was in place earlier. So given that, how much of a dent do you think it's really going to make in terms of addressing the problem?
So what we'll do is just what we've done all along. We'll continue to monitor the hospital capacity. We monitor that on a daily basis. So obviously with these changes in place, we'll see what that does with regard to our hospital capacity and the ability to be able to handle those patients, both COVID and non-COVID, that are coming into the hospital.
And are you open to further measures to try to address the staffing issue?
And so with regard to the staffing issue, am I open to further measures? Yes, absolutely. So this is a preliminary step to address the hospital staffing emergency we have right now, but we'll continue to watch what happens with regard to hospitalizations and may make further steps down the road.
My question is, with the available beds, what percentage of those are for children and what percentage of those are for adults? Because those have different requirements.
Yeah, so with regard to, I don't know, I'll ask Felicia or Dr. Anton, do you know what the breakout between adult beds versus pediatric beds is right offhand?
Well, I know children's has 225 beds, and they're going to add 35 more, and we have 4,200 staff beds, so whatever that ratio is, and that's just children. I know there's some hospitals that also have pediatric wards.
Yeah.
But I can't give you that.
Yeah, I don't have that number right offhand, but we can see what we can do as far as tracking that down and letting them know. I would mention that Children's is opening up their Hubbard Center. They're going to start taking patients on Sunday, and that should add about another 35 pediatric beds to the state right now. And in general, as you look at hospitalizations, we estimate there's probably 6 active hospitalizations when it comes to coronavirus right now among pediatric patients. Yeah, Graham.
What was the trigger for your decision to initiate this directed health measure? Is there a certain threshold you're looking at, or how do you come about this?
So with regard to the staffing emergency, we were talking to the CMOs and the CEOs of the various hospital systems about what they were seeing. And again, what I'm reflecting is what they were telling us with regard to, yes, we're not at the same level of hospitalizations for coronavirus that we were in November of 2020. However, we are seeing a lot more people in the hospital for other reasons, and so that is putting pressure on them that is different from what we saw last fall. And so it was really in response to those conversations that we decided to declare the staffing emergency to be able to help address some of those capacity issues with regard to taking care of people. Yeah, Martha.
So you talk about that you're going to be following this hospital capacity daily. Will you bring back some sort of COVID dashboard? The way that, I mean, before this data was available to everybody every day, and there's been a lot of people, a number of people in the healthcare field who said that that was valuable information, that they would like to have that again.
Yeah, with regard to the dashboard, we have no announcement with regard to the dashboard at this time. We are publishing those data, the data weekly on the Department of Health and Human Services website, so I'd refer people to that. And as you know, we've ended the emergency with regard to the coronavirus, and so we have HIPAA laws that we have to follow, and concerns about that privacy is one of the reasons why we can't break down that granular data. So we don't have any announcement with regard to the dashboard at this time.
Do you have any, are you looking at the possibility of reinstating some sort of emergency or some sort of executive order so that you can reinstate that?
So with regard to any other steps we might take in the future, really getting at Grant asked, we're going to continue to monitor the situation and take other steps as appropriate, but we have no announcement with regard to that right now.
Governor, why the other states seem to be able to provide the data despite HIPAA and Nebraska can't?
So the question about why can other states provide the data and Nebraska can't, I would say most states also still have their emergency in place. I think there's a few northeastern states that do not, and I'm not familiar with what data they're providing. But if you're still in an emergency, you have the ability to be protected from those HIPAA requirements and waive your statutes in your state. Not being in the emergency, we don't have that ability, so we're not going to be able to do that because of Nebraska, the specifics of Nebraska law.
Is it a staffing emergency though? Is it?
This is a staffing emergency. It doesn't have anything to do with, so the staffing emergency does not allow us to be able to waive laws with regard to COVID. This is a staffing emergency. It's very specific.
Is there a reason why you are not reinstating a COVID emergency given the situation that we're facing currently?
Yeah, the reason we're not doing a COVID emergency this time is because this is a hospital staffing emergency. So we're being very specific.
Do you feel like RSV cases are an emergency in this case? I know that is a large portion of the child hospitalizations that we're seeing. And I know a lot of hospitals are actually sending children out of state because there's not enough beds for those children to be treated.
Yeah, I don't believe that statement's accurate. I think it's about, overall, I think there's about 45 RSV hospitalizations in the state right now. I think 33 are pediatric. As Dr. Antone just mentioned, they're going to be adding on 35 beds starting on Sunday at the Hubbard Center alone. They've got 250 or 230? 225 capacity there right now, and I think they've got about 35 that are open. Is that right?
That will be open.
Yeah, so I don't think that's accurate. Now, patients do get transferred for all sorts of reasons even before the pandemic, but I don't believe it's because of a lack of capacity here.
With this emergency now in place, obviously the nursing shortage and everything that's happening in all the hospitals, is the state looking at bringing nurses or more healthcare workers from outside of the state in to help with the shortage?
Yeah, so the question was with regard to bringing traveling nurses in, is the state going to be looking at that as well? That will be one of the things that we are looking at. I think the hospital systems themselves are doing that right now. What we're hearing from the hospital systems is that it's very challenging to bring travelers in right now because they've been deployed to other parts of the country. So obviously we would love to be able to supplement, the current staff that we have here, nurses with travelers. My understanding talking to the hospitals is that that's a challenge right now.
Speaking of recruiting nurses, there was a mailer that was sent out recently that specifically highlighted that state nursing positions do not require vaccinations. Can you kind of discuss what went into your decision to specifically highlight that aspect of a job?
Yeah, so we have a nursing shortage here in the state of Nebraska. That was frankly true before the pandemic. And we have a number of positions open at the state of Nebraska. So we need nurses just like everybody else does. And so we want to recruit them. I also heard from a lot of people when the hospitals made that announcement that they were very unhappy with their employer interfering with their personal health decision. So we wanted nurses not to leave the workforce because we need them all. And so we wanted nurses to know that if there was something that was very important to you, that you could come to the state of Nebraska and we were not going to mandate vaccines.
Now, correct me if I'm wrong, state nursing, that would entail also nursing that happens in the prison system, correct?
That's correct.
There was recently an outbreak at this month, in fact, at a prison here in Nebraska. They suspended visitations and transfers and things like that. Do you feel it's wise to be advertising unvaccinated nursing to these places that are already experiencing COVID outbreaks?
Well, first of all, let's be clear. We're not advertising to unvaccinated people. We're hiring any nurse who wants to come to the state of Nebraska, and we're paying a bonus to be able to come on board to be able to do that. With regard to the employment conditions, we want people to know that they will not be required to have a vaccine. Second thing is that, remember, through the majority of this year so far, and certainly the end of last year, we had our corrections department, our folks in our veterans homes, you name it, Department of Health and Human Services, they were unvaccinated, providing a great level of care. And so we've had healthcare professionals doing an admirable job of providing care whether they were vaccinated or unvaccinated. So the key is making sure we've got the staff to be able to provide that care, and this will, by hiring more nurses, we will be able to do a better job and provide a higher level of care. Yeah, go ahead.
Why now? These issues have been going on for a couple of weeks, hospitalizations have been rising. Were there certain factors you were waiting to get numbers? Why now instead of maybe not earlier when these problems sort of arose again?
Why now with regard to the staffing emergency?
Yeah.
So again, our staffing emergency is based on feedback that we got from the hospitals. So this was just, it's been something we continue to monitor. We continue to have conversations with them, and based upon our conversations that we had with them recently, we decided now is the time to put that staffing emergency in place.
Do the hospital systems seem to be on board with this new hospital staffing emergency, the different changes that it will allow?
Well, the things that we've got in the staffing emergency represent some of the conversations we had with hospitals. So they're reflecting some of the things that they said were helpful when we had the staffing issues before. So I presume that they're on board with the stuff because this was feedback taken directly from them.
Those hospital officials express concern going forward with a rise in cases. I mean, last week, according to the DHHS figures that came out Wednesday, state cases were up 85% from a week ago. And you've got school starting, you've got Husker football starting, with the Nebraska State Fair starting tomorrow, with lots of big events with big crowds, lots of people gathering together. So did you get any of that kind of feedback from the hospitals, or is that a concern that you or Dr. Anton have?
So in our conversation with the hospitals directly, we were really focused more on the staffing issues. And again, if you go look at the chart, you can see that a lot of the pressure is not coming from the COVID folks, it's coming from non-COVID patients. And so we spent most of the conversation talking about just staffing issues. We didn't get into any big events like the State Fair or Husker football games or anything like that. And I'm sorry, what was the second part of your question?
Well, I asked if you personally or Dr. Anton, you guys have concerns just about the multiple gatherings of people that are coming out, everybody's back in school, the universities are back, just lots of people getting together for work.
Well, again, our entire philosophy around how we manage this is going to be focused on hospital capacity, and so that's what we're going to continue to focus on. We certainly encourage people to get the vaccine. That's our number one line of defense against the virus, so please get your vaccine. I would say that if you are 65 years and older and you're not vaccinated, you're a lot more risk than somebody who is, say, 5 years old and not vaccinated. So if you're 65 years old and not vaccinated, I would be very careful about where you go from the standpoint of if you're going to be in large indoor crowds, because the indoor space is typically where, at least a lot of the papers I read say you're most at risk. Be thoughtful about that. So if you're going to go to an indoor space and there's going to be a lot of people there, probably ought to wear a mask.
Back in the spring, you had a matrix, and if percentage of people in the hospital for COVID was over 10%, that triggered like indoor dining restrictions, that sort of thing. Why not revert to that?
So with regard to what we were doing earlier through the pandemic where we had certain percentage levels of COVID beds, we will be thinking about it exactly the same way. So we'll be thinking about, to your point, Fred, that's how we are thinking about it. We'll be thinking about it the same way.
Well, you're over 10% now.
No, actually, I think we're about 8% actually of COVID beds.
Well, it says 11 there on the.
That's 11% of all hospitalizations.
Right. Isn't that the trigger?
No. No, what we were doing was based upon total hospital capacity. It was a percentage of COVID beds or patients as a percent of all hospital beds.
Right, which is 11%.
No, 11% is 11% here is, put this number and this number together to get the total hospitalizations. You've still got 1,000 beds open out of 4,200 beds. So you've still got lots of capacity within the system.
Oh, so you're
Yeah.
saying it was.
So you got to compare, if you want to compare, you need to compare this number, this 33.7 to 42.07.
So about 420 would put us at 10%.
So about 420 would put us at 10%, right?
Okay, so you're still, if I understand you correctly now, you're still thinking you would employ that previous matrix if it got up to that.
So we will be thinking, directionally, that's how we will be thinking about it. So it may not look exactly the same, but directionally, that's how we're thinking about it.
Okay. And then on the HIPAA stuff, I looked up Richardson County, for example, and the latest report from 2019 that I found said there were 5 people who had abortions who lived in Richardson County. The public data appears to show that there are 800 people around in Richardson County that have had COVID. Why is disclosing the number, if it's in the hundreds for COVID, a violation of HIPAA, but 5 is not?
So with regard to the abortion numbers that we're disclosing, I can't give you an answer off the top of my head there, Fred, but we will dig into that and let you know, and maybe we have to change the way we're providing our numbers on abortions too.
That's a separate state statute. That
Oh,
is
thank you, Taylor.
covered under, yeah, it's separate, we can do that.
Right, but philosophically, why is it?
It's the way the legislature.
So it's we can get you a more detailed answer, but what Taylor's telling me, that's a separate state statute that is apparently gives us a flexibility to allow to report that way. But we'll get the details for you on how that all works out.
How long is this emergency potentially going to last? And I mean, like you said, staffing has always been an issue, but what's the threshold at which you would let this thing expire?
Yeah, so the executive order that I put in place lasts through the end of the year. So we'll, obviously make adjustments if we need to, but right now what we put in the executive order that it lasts through the end of the year.
But you don't have any sort of threshold that staffing level that beds would come down to?
Well, we'll certainly continue to talk with the health systems with regard to what they're seeing before we make a decision.
And that's just for the hospital staff and emergency.
And that's just for the hospital staffing emergency,
Is there
correct?
an end to the DHM? Did I miss that? I'm sorry.
Oh, help me out, Taylor. What's the end of the DHM? Yeah, we'll have to go back and look.
Is it like a
September
threshold?
30th? Thank you, Gary. September 30th. Thank you.
Governor, you talked about the importance of vaccination. Is the state doing anything or planning to do anything to try to encourage vaccinations more in the areas where they're low, especially like many of the rural counties are well below? I think the state average now is something like 51 or 52% vaccinated. A lot of the rural counties are in the 30s. Is there any kind of thought to doing more vaccine efforts in those areas to get people to get vaccinated?
Yeah, so the question was about what is the state doing with regard to vaccinations and encouraging vaccinations, especially in rural areas where there may be lower uptake rates. And yes, the Department of Health and Human Services has an ongoing campaign with regard to encouraging people to get vaccines. I know we've done social media around it. We've got other media out there as well that are encouraging people to do it. Just visited a couple of public health departments this past week. They're all focused on trying to encourage people to get vaccines. They're still doing clinics. In some cases, they're going to different neighborhoods, to deliver vaccines personally to people's homes to be able to get people vaccinated. So for both the local level and the state level, we're working to encourage people to get vaccinated. And the other thing I'd point out is that we have seen an increase in vaccinations. So while we saw a summer slowdown, we're certainly seeing that pick back up again, which is encouraging. Yeah, Martha.
Following up to that, aren't you sending a contradictory message to try to encourage people to get vaccines when you're advertising for people with the the selling pitch that they don't have to get vaccines. And, I mean, the people who are going to apply for those jobs, the people that care about that, whether they're being required to get a vaccination or not, are generally going to be the people who are not vaccinated. So we're going to attract more of those people to those jobs.
So Martha asks, are we sending a contradictory message by saying, hey, get the vaccines, but saying we're going to hire healthcare workers who are not vaccinated? And the answer is absolutely not. If you go look at our advertisement, for example, we say, while vaccines are encouraged, it's not a requirement. And so that's the difference between really encouraging people to make a personal health care decision with regard to getting the vaccine or not getting the vaccine. And of course, we want to provide them the data necessary. They know that getting the vaccine is very safe, it's very effective. If there's, if you've heard misinformation with regard to it causing death, there actually isn't a single validated case of a vaccine causing a death in the United States right now. There's I think something like 6,000 case investigations, but no confirmed deaths, my understanding is. Also, some of the other things we've heard with regard to vaccines that they can cause people of childbearing age to become sterile. Again, there's no data to support any of that. So we want people to know the information about it, but we also want to take a perspective, long-term view, is that we need people to do this because it's part of taking, personal responsibility for themselves. That's why, from the get-go, I've been against mask mandates. I believe it's better to educate people about the benefits of it and let them make their own decision.
And on the mask mandates for children, we're having situations where kids are having to, they're being sent home from school, classes are being canceled, because kids are being quarantined for exposure to COVID in the classrooms when there's no mask mandate. And is that preferable to requiring kids to wear masks?
So the question with regard to kids not wearing masks and being quarantined and sent home and so forth, again, that gets back to the parents working with the schools and making that decision with regard to whether they think it's more beneficial for their child to be wearing a mask in school or not being wearing a mask. And that, again, is really a parental choice that we should leave up to the individual to make that decision. And that's why, again, I'm against mask mandates in schools. I believe that's up to parents working together with schools to make that decision.
Schools make lots of decisions that take away parental rights. I mean, they dictate what kids can go to school. They make all kinds of decisions. I mean, why is a mask mandate different?
Well, the difference here is there really isn't anything that shows that kids are at risk. This is what I started off the program by saying. You can look at the data. So if you're going to be data-driven about this, kids are not at risk any more for COVID than they are the flu. And we don't mask kids up for the flu. So kids are not at risk for this any more than the flu, which is why, again, it gets back to looking at, as a parent, do I feel it's important to have my kid masked or not based upon if I have to quarantine or whatever, or the quality of education that I think my child is going to receive, whether they're masked or not.
But in the situation in your classroom is that my child, I may choose to put a mask on my child, but the child next to me or next to my child is not masked and could be spreading the virus that way. So it's not just an individual decision, it's a group decision.
So with regard to masks, one child being masked, one child being not masked, my understanding is that schools are generally taking that into consideration so that if your child is masked, they're generally not quarantining the child. If the child is unmasked, that's when they're looking to quarantine the child. And again, that is a parental decision to make.
On the nursing ad issue, I think one of the reasons that this issue came up was because there are people who have loved ones in the veterans' homes who are concerned about their well-being. What do you say to those folks who have those worries that their father, grandfather, or whatever could contract the virus or could potentially get sick?
Yeah, whether it's our veterans' homes, our correctional facilities, or in Health and Human Services where we have healthcare professionals taking care of people here in the state, the people have been doing that unvaccinated for a long time. So those healthcare professionals performed admirably in taking care of the folks in our system. And we need to have certain positions like nurses to be able to provide that care. And so we don't want those nurses leaving our healthcare workforce entirely. And so there's an opening for them at the state of Nebraska to be able to help do that. And another thing that I'd remind everybody is that we can't afford to close our facilities, right? We can't close corrections because we don't have enough staff. We have to figure out how to manage it. Same thing for our veterans homes. So we need to make sure we've got the proper staff.
Have you had any bites on the ads at this point? Anyone expressing interest at all?
With regard to responses, recruiting to the ads, it's too early to tell. I couldn't tell you. It's probably going to take several months before we know whether or not our level of recruiting is higher post-advertisement versus pre-advertisement.
I think there is a difference between veterans' homes and the prison system, and the big one would be that the veterans' homes are requiring testing weekly for vaccinated and every 48 hours for unvaccinated, and they're also requiring masks to be worn. That is not the case for the prison system or the correction system here in Nebraska. Is that a concern for you? Do you think we should be taking more precautions to protect our population that's in the prison system right now?
Yeah, so I actually think you're, with regard to masks being required in veterans' homes, I actually don't think that's accurate except for certain limited positions. I don't think it's everybody. So I don't think that's universal in veterans' homes. And with regard to corrections, that is certainly something that Director Frakes takes into consideration with regard to how he manages his entire organization. And remember, we have to balance all this off with regard to keeping that workforce so that we can provide those services. Again, we can't shut down, so we need to be able to have folks there to be able to take care of the inmates or take care of our veterans, 24 hours a day, 7 days a week, 365 days a year. So if we limit ourselves in who our workforce is going to be, whether it's through a vaccine mandate or a mask mandate, that could harm our ability to be able to provide those services.
If the hospitalizations approach 10%, would you have to initiate a DHM in order to restrict restaurant capacity, that sort of thing? And would that also carry with it the possibility of reinstituting a dashboard?
Well, again, we're going to continue to monitor the hospital situation, Fred. As I said, we're thinking about it very symmetrically to earlier in the year, when we came down out of our peak hospitalizations. And with regard to what happens as we go up, we're thinking about it in the same sort of way, but I'm not going to get into specifics about what those steps would be.
I guess what I'm asking is, does a DHM require a state of emergency?
I believe a DHM does require a state of emergency. I'm going to look at Angie and Dr. Antone, is that right?
DHM did, that's what.
Yeah, so DHM does require a state of emergency, right?
Could you, this DHM without the state of emergency?
This DHM is related specifically to the staffing emergency I am declaring in the hospital staffing emergency.
Have you declared a staffing emergency before? Is there any precedent for this at all?
I have not declared a staffing emergency before. I don't know if there's any precedent for doing this before. Martha? Oh.
Governor, a couple months ago, you were talking about the need to get back to normal. And what are your thoughts on that from this perspective?
Well, with regard to what we're doing here, frankly, having a nursing shortage is something that we, in general, I would tell you any employer is having difficulty finding people to work. We've got 2.3% unemployment rate, right? So we know that we've got a lot of people employed. This was a challenge that we had before the pandemic. So we just have to manage this as we manage, the hospitalizations that we've got and still return to a more normal life, getting back to it. So just part of how we have to manage it. And I think it's also important to note, folks, COVID is never going away. This virus is going to be here forever, right? So we have to learn to manage it. The best defense we have is to get that vaccine. But this virus is actually never going to completely go away because it's a virus. It's going to be out there forever.
What did the hospital administrator tell you? I mean, if this staffing issue were to continue to go unresolved, what sort of scenarios did they lay out?
Well, you may recall last year we actually had more restrictions with regard to elective surgeries, so that's one potential there. And we'll be looking at other things that, again, as we continue to manage this, and we're watching the data on a daily basis. So we'll continue to work with the hospitals what other steps that we might be able to take.
I know this gentleman has brought up the 10% number
So we will make announcements, and of course, we publish the weekly data with regard to our numbers here in the state, and we will certainly make an announcement if we're going to be going into a DHM and have other restrictions on top of this.
Time for just a few more questions.
2 more questions.
I have a question either for you
Yeah.
or for Dr. Anton. It's sort of loosely related. Is anyone in the state tracking the impact that the Sturgis bike rally had on Nebraska? A lot of people coming back through, or are you expecting any increase in cases because of that, because we're relatively close?
Yeah, with regard to the Sturgis bike rally, and I'll give Dr. Anton a chance to respond to this too. If you look what happened last year, actually the rate of infections that were confirmed in the Sturgis bicycle rally was well below the actual background rate of cases in the country. Now, there could be a variety of reasons for that, but there were very few cases that were actually tied back to that Sturgis rally through contact tracing. So I don't know that we would see anything because the numbers were so small last time. I think it was like 82 cases out of the 460,000 people that went there. That might be an old number. Maybe they've been able to track some more numbers of that, but you get the idea of the scale between the types of numbers. Specifically with regard to people coming back from Sturgis through Nebraska, Dr. Anton, I don't know if you've got anything additional to add with regard to how we would track that?
Nothing from the hospital saying they've seen any tie into Sturgis, probably World Series. It's probably too early for Garth Brooks now, but I've not heard anybody say they can directly tie in any increase to those events.
None of the hospital systems have talked to Dr. Anton about anything they've seen to be able to tie increasing cases to Sturgis or the College World Series, and as Dr. Anton points out, it's probably a little too early for Garth Brooks, but so far we've seen nothing. Last question.
How do you feel about the death rate so far?
Excuse me?
The COVID death rate, it appears to be a little bit lower than before, when early on in the pandemic, during the surge and everything, the fall, winter. But deaths have been picking up these past few weeks.
So with regard to people dying from coronavirus, first of all, any death is going to be a tragedy for that family, and I think everybody understands how hard that is on those families to lose a loved one. With regard to specifically here in Nebraska, with regard to that, our doctors and nurses have done a tremendous job of learning how to treat coronavirus. I can tell you when I was looking at CHI St. Francis in Grand Island, when they went through the surge in April 2020, those doctors and nurses were able to learn every week how to treat those patients better and to save more patients' lives. And I gave you the statistic earlier on that if you look at the Kaiser Family Foundation, they rank Nebraska number 3 best in actually preventing death among people who have coronavirus. And again, that gets back to the great work our doctors and nurses are doing. And just overall, you're seeing the same sort of trends across the country that you're seeing here in Nebraska as well. So this is not something that's unique to Nebraska with regard to increasing case counts and that and the fatalities that are accompanying them. All right, folks, thank you very much. Appreciate taking time today. We'll talk to you later. Bye-bye.